Good afternoon.
Hello, thank you for having me. Super grateful to be able to speak today. I'm Sydney Griffith, as you said. I'm an advocate and community organizer in Boston. I recently went to a meeting held by the Massachusetts Department of Agriculture and was disturbed by their vague and apathetic responses to the community's questions regarding the lack of licensure for selling CBD, a non-psychoactive compound. Please work with this department, as their slowness in rolling out retail licensing for hemp and CBD products is forcing those who legally farm and produce CBD to risk selling their products in storefronts. They could be confiscated at any time, lost at any moment, or forcing them to find alternative underground routes for distributing illegal product. Please also help this department uncover the issue. I don't even think they know what it is based on their responses. Is it the labs, processing, systemization? Please also let the community know so that we can also be involved in finding a solution. Next, cannabis in Massachusetts is legal and medicinal, and yet there's no place to consume it. How do meeting places currently thrive around alcohol consumption, which kills more than 100,000 people per year in our country, and there's no designated place for consumers to simply bring their own? I'm not talking about places that distribute and sell. I'm talking about a place for people to safely consume their own cannabis, amongst others. Next, I'm asking that you please create a policy and program that assists individuals threatened by cannabis-intolerant landlords or individuals that are kicked out of their homes by cannabis-intolerant landlords. There are also a few other programs I'd like to propose. A program that educates and employs individuals in the cannabis industry who have been incarcerated for possession. A robust training program designed to educate and certify individuals seeking to legally participate in the industry. A program designed to raise funds that would be allocated to social equity applicants, as well as a program that consults these applicants so they can gain more assurances around their applications going through and their licenses being issued. On a separate note, I know locals seeking grow, manufacturing, and retail licenses who have applied and have been waiting, and then suddenly large, established, big money-backed and out-of-state companies have received their licenses and storefronts suddenly and out of nowhere. In the meantime, my question is, how are you working to elevate and help locals to avoid this happening over and over again? Next, when a medicinal patient and recreational user go to a dispensary, I believe there should be more transparency and information around where their cannabis or cannabis products have been grown or produced. Who grow it? Local small organic operations or a giant out-of-state conglomerate capitalizing on Massachusetts law? Labels or special menus listing local grow operations could very much help, I believe. Next, I propose there be formal roles in place to be filled by representatives serving the many different sectors and spaces in this industry. For example, a representative for medicinal patients, adult users, social equity applicants, and social consumption applicants. I believe if you posted these roles, they'd be filled immediately by individuals who are currently enthusiasts, advocates, community organizers who would love to be involved and to represent the community. Lastly, my own personal experience getting my recommendation for a medical card was incredibly disturbing. The doctor incorrectly explained the difference between indica and sativa, didn't mention the endocannabinoid system. She had no talk track whatsoever, was rushed, and didn't even look at me in the eye. This was pitiful and terrifying, as many first-time patients, this would have been their first interaction with a professional in the industry. So if we could have better vetting of people who are in this role, that would be amazing. And that's about it. Thank you, guys.
Thanks so much, April. Next speaker is George Highlander.
Good afternoon, almost there. George Hightower.
I'm sorry.
No worries, it's okay.
I apologize.
I have poor handwriting, so a little bit nerve-wracking.
Handwriting recognition, so I'll take the blame, but go ahead.
Oh, good. Thank you so much. I thank you for the chance to speak in front of you. I'll be brief since it seems like many of the issues that I brought up have already been spoken on very eloquently. Maybe I'll keep my things to a little more bullet point fashion. As Mr. Pollack mentioned, I think it's important to find a way to streamline the agent registration transfer of cards, or as he says, if you're going to be having the opportunity to work as an advisor, consultant, or some kind of contractor with multiple RMDs or the locations, it would be nice to not have to go through the process as well as the cost and the difficulty of getting them renewed. I think it's also important that we work quickly, not only with social consumption, but also with the home delivery for retail. You certainly have done a great job, at least nominally, in terms of putting the system together. The question is, can you find something quickly that is legal, that assists homebound patients, alleviates lines, allows for discretion for certain people who don't want to be exposed, It also increases the efficiency of the market. I think it's important that those businesses which have been working for several years, if not living longer in the state, should also get some kind of priority, especially those who are participating in the social equity training programs. Furthermore, as mentioned by the young lady just before me, it would be nice if there were not something necessarily anti-competition, but if there were some benefits or streamlining towards application review for people who have been local, as opposed to many of these out-of-state operators. As I've seen with my software company, it's easy enough for someone outside to repurpose their software that isn't designed for Massachusetts regulations and call it the best thing since sliced bread. However, those are fundamentally systems which weren't built for our market, and using what we have designed over the last 5 years, you can find the ability to reduce diversion, perhaps allow those operators which were previously in the black market and now have removed themselves from those activities to quickly get into the market by using software solutions that allow them to solve many of the concerns of the Commission, public safety, and for proper reporting through taxation. I think it's also unfortunate with the social equity training program that when you did such a good job on it, you've then had to scrap the application process. I think it would be really important to try to get this program off as soon as possible, because there are many local businesses that do genuinely want to help those disenfranchised and pass on their knowledge to make this a more equitable and fair market for everyone. As the young lady mentioned before, very important if you could provide some kind of guidance, even just showing the documents you've used to the Massachusetts Department of Agriculture for hemp. You've put so much time, and I know it's not under your purview because it has less than 0.3% THC, but perhaps even just sharing your thoughts or notes might help them get forward. That's about it for today. Thank you very much.
Thank you very much. Appreciate it, George. Next speaker. Okay, we're going to do one more speaker. We're going to take one last break, and then we're going to power through the remainder. I think we'll get done certainly by 4, maybe a little before, but let's have one more speaker, and then we're going to take a break. Hilary King. Afternoon, Hilary.
Hi, can you guys hear me okay?
I can get it back. Yeah, we're good.
All right. So my name is Hilary King. I'm a consultant in the industry, an advisor, an educator, a patient, and an advocate. I've worked over the past 4 or 5 years immersed in the industry, working with patients, with caregivers, including caregiver delivery services and collectives that are serving patients. I've worked with other industry startups, including folks that are applying for licenses in the adult use program. So I come with a kind of a variety of perspective from different sides of the industry. Currently, one of the companies I work with is called GoFire. GoFire's created a technology that's a digital platform for tracking data on consumption of infused products and the related symptom response from the people consuming them. But it's all tracked and based on actual third-party batch lab results. And the specific dose of each product as well. We recently launched beta testing on a piece of hardware, a truly precision meter dose inhaler to vaporize cannabis concentrates that has a smart chipped cartridge that syncs to this same platform to cover multiple methods of consumption for dosing regimens. So like Nicole and others have suggested, so we can kind of start to tease out what are these minimum effective doses that are working for what ailments, based on the actual chemical profile of not only flower but infused products that are more easily controlled dose. So everybody, please check it out. If you have any questions, let me know. And then a couple points that I'll just touch on because a bunch of people have already mentioned them. Social consumption regulations I think are critical, including allowing both vaporization and inhalation smoking. I think it's, again, the edibles is, like Ethan said, not the best place for most folks to start. And in terms of the culture, people are inhaling this stuff. We just have to be real about it. Delivery-only retail, I've advocated for this for a while, including for caregiver services that are already operating. And I would say that the focus on regulating that should be towards protecting the people that are going out and doing these deliveries and making sure that people who are homebound, people who can't get to their dispensary, continue to have access. Recalibrating the licensing and application process, I think that you're absolutely right, Commissioner Title, that whatever's going on is not working, and the first step to kind of course correcting is being willing to admit that and choose to go in a different direction. We need to ease the path for small businesses that might not have the capital to throw down on real estate for months and months at a time as they wait to get through the processes that are getting held up at the municipal level. Vape cartridge hardware. So I believe this issue is on your radar, but I'd like to share my personal experience in the interest of public health and safety, especially for medical patients. I was a judge in the vape cartridge category for a local cannabis competition that happened at the end of last year in Massachusetts. Initially, the entries that were submitted were sent to the lab already filled with the oil sitting in the cartridge. And judges were told that they failed the heavy metal screenings primarily for lead. They followed up with a second round of testing, and that tested clean. However, I talked to my friends at the lab, the second samples were just submitted in a vial or a jar and had never touched the inside of a vape cartridge. And we're starting to hear this conversation happening all across the country with some regulatory corrections in Colorado, California, to really take a look at the quality of the hardware, because it's possible that vape oil is leaching heavy metals from the actual cartridge hardware into that oil, and who knows if or how much of that is getting into a patient's lungs. So I think it's really important that we kind of address this. I asked around at a bunch of dispensaries, and most of them told me that they just submit a bulk sample for testing. They don't submit a filled cartridge that kind of mimics the real world conditions that are happening with these products. So I'm not a scientist. Some suggestions: require documentation of the material safety data sheets and quality control on cartridge hardware. Consider leachability testing and figuring out how to test the oil that's been sitting in the cartridge for a while, how to test the vapor that's actually going to be going into people's lungs. I'd like to commend Commissioner Flanagan on her commitment to positive impact plans, making sure that that's not just lip service. I think that's really important, and having it be a condition for relicensure at the end of every year. If you give me just a minute to close, I think it's important to remind everybody of the definition of unreasonably impracticable, which is in 935 CMR 500. This means that when a regulation is unreasonably impractical, the measures that are necessary to comply impose an unreasonable risk or require such a high investment of risk, money, time, or any other resource or asset that a reasonably prudent business person would not be able to operate a marijuana establishment. So please just consider in your decision making if your choices either remove or reinforce the barriers to entry that exist.
Thank you, Hilary. Okay, we're going to take another 10-minute break. I just want to make 2 requests. One is please get back on time so we can get started again. Also, in deference to our hosts from the Gaming Commission, if you could not congregate in the hall and have loud conversations, that's their main entry for their own business. And so they're doing us a great favor by letting us use the facilities. I really appreciate it if you help us out in that. So thank you. We'll see you in 10 minutes.